and welcome back to another episode of the Best Kept Secrets in Healthcare Show. I'm Dr. Ray Drury, this is Dr. Tim Hartman, and what we want to talk about today is what causes neck pain. Now, Doc, we get people coming here every day with wide ranges of neck pain, most of them have been all over the country and tried this and that and the other, and they still wind up here. Why haven't they gotten some help before now?
Yeah, it's so interesting, and like Dr. Ray just said, so many people, we've even had people fly into this office, been to medical doctors, been to surgeons, been to other chiropractors, and Doc, it's so interesting that we find that the cause isn't from a drug deficiency.
Yeah, right.
They're just dealing with the effects. Why has that been the case?
Well, because, no cause has ever comes from a drug deficiency. I don't care if it's neck pain, if it's headaches, if it's digestive disorders. No drug deficiency has ever caused any ailment in man, right? So taking a medication is never going to fix anything. As a matter of fact, it could obviously add additional issues to your problem. We have an opiate problem here in the United States, the Oxycontins and all that kind of stuff. People are becoming addicted and doing crazy stuff just trying to maintain their addiction. So taking medications has never fixed neck pain. Matter of fact, too many body parts is also not a cause of neck pain.
Absolutely. As we go into neck pain, when we look at, especially the upper cervical spine, this is where the neck is. This is those top two bones in the neck. Believe it or not, these top two bones not only just responsible for, pain and perception, right? When we turn our head, 50% of rotation is involved with these top two bones. So not only do people suffer from neck pain, what are you going to do when you have neck pain? You really don't want to turn your head that much. So that's where a lot of that rotation takes place, and everything that goes below that is due to compensation. You want to explain more on that?
Yeah, so what happens is you have this bowling ball, right, that sets up on top of those two bones, and that head weighs 10 to 12 pounds. The atlas weighs about 3 ounces. And if that bone gets a little out of position, it's going to take that bowling ball and turn it. As we say, it's going to make your head not on straight, right? Have you ever heard your mom ever tell you, boy, you better get your head on straight? Well, what happens is it'll take that head off a little bit. Well, the brain doesn't like it, so to get the brain level, your body will compensate. It'll twist, it'll turn. You'll see people, their heads out here. You see people, their heads back here. You'll see people in pictures, one ear's always higher than the other. Well, that's because that bone is taking that head out of position, forcing your body to compensate. As a result, gravity pushing down, you lose your normal curves, you start to develop tight, stretched, contracted muscles, which can in turn lead to wide ranges of neck pain.
Absolutely. So, even a small misalignment here of both of us pretty avid Panther fans, right? Panther Nation. We see Khalil, the center for the Panthers. He actually was reading an article. It said that he's suffering with a crick in his neck. Now, Doc, how does a crick in his neck, how can that lead to pain, or what happens? What's the physiology behind that?
Well, it's a compensation somewhere in the neck. The initial cause is one of the top bones, always is. They get out of line, and the body compensates. And so, and those other bones get moved and pushed, and so it just takes just a little movement in the wrong direction, and boom, it can cause, real spastic pain. At the same time, it can affect those discs. Those discs are all stacked up between those bones. And you know what happens when those discs compensate? Absolutely, Doc. As we go into the lower part of the neck, right, that's where those discs are. We see people all the time that say they have neck pain, but it actually radiates into the arm, right? It can lead to things, maybe they get diagnosed with carpal tunnel, right? And a lot of the times, 80% of the time, in fact, it's from double crush syndrome. And actually that comes from those top two bones in the neck, right? When these bones misalign, these lower bones in the neck start to misalign, pushing out those discs, squeezing out the jelly, compressing that nerve, and that's what causes that nerve distribution of pain all the way down. Sometimes we feel numbness and tingling. Plenty of patients before will be laying back in the resting area, and they'll feel like their arm falls asleep. Yeah, and sometimes that's those discs just kind of moving back into place.
Absolutely, but what's even worse is that it can actually affect the nerves, not just going to the arms and hand, but affect those organs that are at the lower part of the neck. Doc, what organs are those?
Well, so when you look through here at this brainstem area, so every message from your brain has to go through these top two bones to the heart, liver, lungs, kidneys, arms, legs, even up into your head, face, and neck. So the neck pain could be like the tip of the iceberg, okay? But yet at the same time, the bones could have been out of line for years, maybe affecting your digestion, your blood pressure, your heart rate, how you sleep, your immune function. So this little piece here, although the neck pain may be what's, irritating you right now, there could be a whole lot of other things going on just as a result of those bones being out.
Absolutely, and that's why we're so thorough in this office for figuring out exactly what caused it, right? We're not worried about treating the effects, even if it's something as severe as neck pain, right? We got to figure out what caused it. So we would do a thorough consultation, right? A thorough postural and neurological exam, and then of course taking 3 very specific three-dimensional digital x-rays to see exactly how those 2 bones have been misaligned, causing those compensations in the lower part of the spine. And it's so interesting, so many times when it's been there for 10, 20, maybe 30 plus years, even just the cause of that accident, we see the degeneration down in the lower part of the neck. Now, one thing we do know is that's the physical problem. You know, it can't be corrected with a chemical solution. We've got to have a physical cause, a physical correction. Doc, and what can we do for them today?
Well, so one thing I want to add though before we go is a lot of times, as we started on, and you kind of hit on it, that pain is maybe the tip of the iceberg. Then maybe this could have happened. It always starts from some sort of a trauma, always. A slip, a fall, an accident, a car accident, sports injury, birth. Okay, so this could have started years and years ago, and your body's been able to adapt and compensate to it, and now I can't compensate anymore, so now the pain's there. So I want you to understand that although your pain's only been there 6 months, a year, 5 years, it could have initially started years and years and years ago. All of these are the things we're going to find out, right? If you come into our office, if you live in the Charlotte area, we've got to make sure your head's on straight. If it's not, we got to figure out why and what we can do to get your head on straight. So what we do is we offer a free consultation, an opportunity for you to come in and sit down with one of us to find out what is actually causing it, how long it's been there, how severe it is, which will give us a really good idea of what we can or can't do to help you. And if we can help you, we'll explain to you what we need to do that. If we can't, then we'll try to find someone else that can. Now, if you're not in the Charlotte area, do yourself a favor and try to find an upper cervical doctor near you. If you have a hard time, give us a call at the office. We'll try to find somebody for you. But try to find an upper cervical doctor to find out what's really causing this neck pain, because if you don't ever address the cause and you keep masking it, it's never going to go away. Matter of fact, eventually it could get to the point to where you have to do something more drastic, like some sort of surgery. Right? So thank you guys for tuning in to this episode of the Best Kept Secrets in Healthcare. If you learned something today, please share this with other people. Please subscribe to our website, our Facebook, our YouTube page. Every week we're going to come up with new topics, new secrets about health that you're not going to hear in mainstream media, you're not going to hear from your doctor, because we want you to be an educated consumer so you and your family can experience the best health possible. So thank you again for tuning in, and we look forward to seeing you on the next show.